15, 20 minutes, and then we'll open up the floor for folks to questions, comments. So, take it away, Seamus.
Thank you, Genevieve. I'd like to thank everybody for coming here today. It's been a really good Socialist Alternative Conference, our sixth. I was a little bit nervous when Brian here told me the running order that I would be speaking after Siobhan. And having seen lots of footage of Siobhan's brilliant campaign in Seattle. But I'm quite excited about the fact that Social Alternative is running me as a candidate for Boston City Council. It's the second time we ran. I'll mention the previous campaign in a few minutes. But I feel I'm running not, as I said, as a politician or develop a political career. I'm running as an activist, as a socialist activist, as a trade union activist and nursing activist. My union, the Mass Nurses Association, and its national affiliate to the National Nurses United, is a union that believes in social activism. It believes, as a nurse, I care for people when they come into my hospital, I care for them at the bedside. But we believe that it's not enough to just care for people when they're sick at the bedside. We also need to care and work for the ills that affect our community. That's a belief in my union. It's also a belief that's strongly held because I've been a lifelong socialist. The Mass Nurses Association and the NNU, we fight for nurses, for our working conditions, and to win decent contracts, because we believe that nurses deserve a decent contract. But we also believe that the rest of America deserves a contract. And the National Nurses United and NNA have been campaigning for Main Street contract in America. I think it was mentioned this morning. And that's a program of demands, a set of demands and a campaign that fights for single-payer health care, that fights for a jobs program, that fights for a financial transaction tax we call Robin Hood tax, and that we also fight for safe staffing, for nursing patient ratios that allows nurses to actually deliver safe quality care. And we've seen that campaign actually being fought for by nurses in Quincy, where the MNA nurses there went on a one-day strike, and now there's a vote taken in where nurses have voted to strike in Worcester. And those are for patient care issues. The crisis in healthcare is a crisis of corporations coming in and attempting to plunder and strip and mine healthcare for profits to the detriment of patients. And the main barrier that's been fought against that is nurses, and nurses' unions are leading the charge against that. And I'm running this Socialist Alternative campaign is running for Boston City Council as an alternative to the politics as usual. I'm glad Sharma mentioned the NNU resolution. I'm very proud of that resolution, that we were able to oppose the 185,000 members of the National Nurses Union, that we need to break from the politics as usual. And really what we see with the Democrats and Republicans, the parties of the political establishment, that there's bipartisan agreement on one particular issue. And that issue is that the cost of the economic crisis, the crisis that was caused by the greed and the gambling habits of the Wall Street and 1%, that the cost of that must be paid by ordinary working people. And we can see that reflected in all their attempts to take back the gains that generations of working people have won in society. We saw it in Wisconsin from the Tea Party governor there. And it was a brilliant, exhilarating campaign of fight back that was launched that came from below and really inspired activists and working people nationally. That movement that was built in Wisconsin ended up being defeated, and was defeated because the conservative Labour leaders and the established politicians took that movement and channeled it into to get out the vote, to replace right-wing Republicans with right-wing Democrats. We can see how that worked out in a defeat. We've also seen that's not just right-wing Republicans seeking to take collective bargaining rights away from public sector employees. In Massachusetts, it was the Democratic Party, that voted, despite promising AFL-CIO and the Labour movement that they would never do such a thing. They took away the collective bargaining rights of public sector employees and their ability to negotiate for healthcare benefits. We've seen in Michigan, we've seen that the right to work for less laws have been enacted, and there's almost no state in the country that is not under threat for working people having to work under the right to work for less labour laws. And a labour movement, and as socialists, we must help the labour movement draw the correct conclusions, the lessons from these defeats. That political parties that are funded by corporations are going to be controlled by corporations and big business, and they're going to carry out an agenda that is in their interests, not our interests. And really what we see is an abusive relationship, particularly between the Democratic Party and the labour unions and working people. This abusive relationships, we see an abusive relationship is littered with behaviour, broken promises and constant betrayals. And then following, we always see the politicians, and they again pledge their undying love, they bring us flowers, and they promise that they'll never do it again. But with any, but really what we have to say is that this cycle of abuse has to stop, and working people in labour needs to develop a healthy relationship. We need to have confidence in our own collective ability to organise and to act independently. And that's what the opportunity we have in running for this in Boston City Council is a platform that we can put forward some concrete ideas. I would say that the main thing within the campaign is that we really want to have an impact. We want to shift the political debate. We want to pose an alternative, a positive alternative to the politics as usual. And if we look at how reforms have been run historically, the last major reforms we can look at that were run in this country were in the 1970s. And we saw the ending of an imperialist war. We saw significant wage increases for working people. We saw equal pay legislation. We saw road versus rail and abortion rights protections. The Environmental Protection Agency was established. Affirmative action programs were established, and there was a large expansion of the Medicare program. All these were achieved under the Nixon administration. And it wasn't that Nixon was a good guy or wanted to implement those reforms. It was because he was faced with, at the same time, numerous mass movements. There was movements of a huge anti-war movement, a women's rights movement, an uprising of labour with wildcat strikes, a black empowerment movement and a Latino rights movement. And he granted those reforms, those reforms granted from the top to prevent revolution from below, to prevent the movement going too far and actually threatening the control that the 1% have over society. And this campaign and this election, we will use, if elected, we'll use a position in the City Council, not that we feel an elected position in the Boston City Council by itself will actually change anything, but we'll use it as a platform to support struggles, to support movements that will inevitably develop as the 1% seek to attack working people and make us pay for the cost of their crisis. At times, as a nurse, I feel that when I see the politicians and I see what has happened in the last period, I see the regulators and the way they behave. It's as if they're suffering from some medical condition. They seem to have very poor vision, not able to see what's in reality around them. Their hearing is incredibly poor. They're developing cognitive and there seems to be neurological deficits of not knowing what to do or how to act. And as a nurse also, we try to come up when we have any ailment with a treatment plan. And this is what this campaign wants to do. We want to have a treatment plan to help these poor politicians and to put forward some solutions to these problems. To give a couple of local examples of what's happening in Boston, to emphasize this, we saw in my community where I live, in the Faulkner Hospital, we saw one of the few remaining inpatient addiction units being closed by the Partners Healthcare System as they strive to move into the lucrative profit-making areas and slash and burn away the services that won't make them the super profits they want to make. So we've seen that this addiction units being closed. Mayor Menino came out and said he was totally opposed to this, but seemingly wasn't able to put forward any idea how you could stop this. The same with the regulators, that their job is to ensure that there's proper services, healthcare services provided to meet the needs of people in Massachusetts. We've seen in my hospital in Cambridge the announcement that they're going to close a child's psychiatric unit. There's a huge crisis in Massachusetts as in relation to facilities and care for mental illness. It's only a few years before that we've had other units, psychiatric units, closed in my hospitals. We've seen the Taunton State Hospital. But these regulators and these politicians can't seem to find the will to act. Another example in Boston is recently the taxi drivers, Boston taxi drivers. I mean, there's been articles in the Globe highlighting the horrendous conditions and exploitations of these low-paid, mainly immigrant taxi drivers. And when this came out, Mayor Menino and members of the City Council, Boston City Council, said, "We didn't know. If only we knew." The taxi drivers have said that since 2000, the taxi drivers were made independent contractors a while ago, and they say that since 2007 they've been petitioning the regulators, the Boston police, that meant to regulate the Boston taxi industry, and they've been petitioning the mayor. But somehow, he's again, this medical condition affects their behaviour. And the Boston Taxi Drivers Association are calling for that these taxi drivers should be hired as workers with benefits. And we fully support that demand, and we will highlight that demand in our campaign. But we've also seen the foreclosure movements of banks and the lack of regulation and the blindness and the problems that these banksters have caused. We've seen in 2012 it was 2 million homes were foreclosed. That's actually a slight decrease on the record numbers there was a number of homes that were closed in 2011. In Boston, these banks have been foreclosing, they forced particularly low-income and working people to they forced toxic Ponzi-like scheme loans onto working people and led to this disaster. There's one firm called City Realty. It's a firm of real estate speculators that have gone to the banks and have bought up cheaply these loans. And their first action with these foreclosed homes is that they immediately increase the rents. The rental units are mainly low-income people living in a lot of these units, and Boston rents are some of the highest in the country. City Realty, the first action was to increase these rents between $250 and $400 a month in one go. The owners recently came out and they made the comment, "Why are we greedy if we're into making a profit? Isn't that what America is all about? These families have the right to leave." So that's some of these people that we're faced with. The program that our campaign is going to run on, the ideas we're going to put forward in regard to foreclosures and evictions, we call it for an end moratorium on foreclosures and evictions. We call for a rent ceiling to make Boston an affordable city for ordinary people to live in. We call for a $15 an hour living wage. It also calls for a jobs program to rebuild our crumbling infrastructure, to massively expand our public transportation system, and also to protect the environment, to slow global warming. We need to promote and massively build public transit. All of these jobs should be provided at union rates of pay. We also say no to the T-fare hikes, and we can see how they're affecting ordinary working people. Cuts we oppose cuts in services and public transport and layoffs. For seniors and disabled people, the recent space have seen a doubling of the cost of the ride, which means that many of these seniors are forced and confined in their homes, unable to get out and interact in the community. But also the institutions of government in Boston. We call for a democratization of those institutions, that the real power and control of decision making, much of it is made in unelected, corporate-dominated boards. So we call for MBTA. We call for an elected Boston School Committee. We call for an elected redevelopment authority to put power and control back into the hands of working people and make these bodies accountable. On our public schools, we're opposed to the creeping corporate influence and control over public education and the attempts to bring in privatization. We see that Wall Street, private equity companies, and big corporations like Walmart and Microsoft are coming into education because they see in education there's a $500 billion federal budget on education spent on education. And like in healthcare, where the corporations have come in and are capturing more and more the healthcare dollar for their pockets, they see that this is an opportunity for them to move into education. And lots of discussion you hear in the media about local politics and education is related to that particular issue, that is corporations seeking to make a business opportunity. The writer Jonathan Kozol uses a term that a quote from a business analyst says that the corporations view the K-12 market as a big enchilada, and they're seeking to take advantage of this. We oppose, and the biggest barrier to that attempt, are public school teachers and the public school unions, which is why the corporate media are attempting, and the politicians are attempting to demonize public school teachers, and they're attempting in order to effectively push their agenda forward. We call for increased spending on schools and to develop programs that will actually give teach kids a broad curriculum to allow them to develop, to be able to think critically for themselves. Instead of what's being proposed, which is a narrowing of the curriculum. This high-stakes testing is just another attempt to impose this agenda, and constant evaluations of teachers in an attempt to intimidate teachers. And we see the teachers, their main motivation and main interest, they're not going to become millionaires out of teaching and make money out of teaching, unlike corporations. But their interest is that the kids become productive members of society. But the corporations see education, and by narrowing the curriculum, they want to have an agenda to produce just kids and educated youth to meet their job needs. And just to wrap up, I'm very excited about this campaign, and I appeal to everyone here to get involved with this campaign, to help us. That one of the biggest obstacles we face, principally because we had the audacity to run in 2007 and had an impact in the campaign, the Boston City Council and the Mayor endorsed the state legislators to change the ballot access laws, and they moved from, they tripled the number of signatures you need to get on the ballot, and at half the time. We need 1,500 signatures, which is in reality 3,000 signatures, and we've only 3 weeks to collect them. So we're confident we will get on the ballot, but we need support to anybody that can help us do that. We also need people to get involved in the campaign to help finance it. When we refuse to accept any donation from corporations of any links to corporate money. And we also pledge that this campaign will be different from the politics as usual, in that as a candidate, like other candidates where we run, with Socialist Alternative run, I pledge, like Sharma did, that I will accept not the exorbitant salary that a Boston City Councillor makes, but to accept the average worker's wage in Boston. And the rest of the salary we put into building campaigns and movements to help the 99%. Thank you again, please get active, please get involved, and this is an opportunity that we can actually shake things up and start the process of rebuilding struggle and movements to bring back change.